we're going to look at the care under fire phase. At this time, the enemy is actively engaging you, and you will only have time to manage life-threatening injuries. One of these injuries could be airway compromise. The easiest and most efficient way to deal with this is to roll the patient on his or her side to allow their tongue to relax without blocking the airway. To do this, simply grab the patient's feet and twist them around one another until it forces the patient's body to follow. Once the patient is on his or her side, place an arm out in front of the patient and bend the leg to the rear of the patient, ensuring that the patient will not roll too far either way and remove themselves from the recovery position. Still, care under fire, but behind cover we will now simulate a patient that is experiencing respiratory distress. The patient has not lost respiration. Simply prop the patient up to help open his or her airway. Now we will look at the tactical field care portion of this exercise. The medic comes upon a patient that appears to be unconscious. When a patient becomes unconscious, all of the muscles in the body relax, thus allowing the tongue to rest in the back of the throat, occluding the airway. Simply removing the tongue from the airway will allow the patient to resume breathing on his own. One method of opening the patient's airway is the head tilt chin lift method. To utilize this method, simply place one hand on the patient's forehead and the other under the patient's chin. With a slow movement, gradually tilt the patient's head back until the neck forms a straight line, thus clearing any occlusion from the tongue. Once you have done this, look, listen, and feel for your patient's respirations by placing your ear next to the patient's mouth. When doing so, ensure your face is pointed towards the patient's torso so that you can see the rise and fall of the patient's chest during respiration. You should be able to hear the patient's breath, as well as feel the patient's breath on your cheek. The other way of opening the airway is the jaw thrust method. This method is utilized when the patient is suspected of having a neck injury. To perform this method, simply place your thumbs on the patient's chin, while grabbing the back of the lower jawbone with the rest of the fingers on each hand. Once your fingers are in place, slowly lift on the lower jawbone, thus opening the airway without moving the head or the neck. Next, we will be covering the nasopharyngeal airway. The NPA provides an open and patent airway and helps to keep the tongue from relaxing over the trachea. Do not use the NPA if there is a history of head trauma, the roof of the patient's mouth is fractured, if there is clear fluid leaking or bleeding from the patient's nose or mouth, or if brain matter is exposed. First task when inserting an NPA is to ensure that you have the right length. To check the length, simply measure the NPA from the edge of the patient's mouth to the tip of the earlobe. Once you're certain you have the correct size, lube the airway adjunct with a water-soluble lubricant, such as surgical lube. Once the NPA is properly lubed, ensure that the bevel of the NPA is facing the center of the patient's septum. Then slowly insert the NPA into the patient's right nostril. It is common to experience slight resistance when inserting the NPA, but do not force it into place. If the NPA does not insert properly into the patient's right nostril, simply remove it and try to insert it into the patient's left nostril, again ensuring that the bevel is pointed towards the patient's septum. Once the NPA is properly in place, simply secure it with medical tape to ensure it will not get pulled or pushed out of place when transporting the patient. When taping down the NPA, do not cover the hole in the center of the NPA.